Overall, I think these results will have very little impact on day-to-day practice in the end. I think there's been more evidence that AIs are better than tamoxifen, so there may be an additional shift towards using the AIs even more. First of all, I think these are very important results because it does indicate that there are differences in individual women in how they respond to treatment, which can be picked up initially by these endocrine symptoms. Ultimately, we may have genetic tests for that, but it does indicate that women that develop symptoms are going to get better benefit from the drugs than women that don't. So I think that's an encouragement, first of all, to persevere for a bit longer and see if you can put up with the symptoms. They generally resolve over 6 to 12 months. So I think that's a very important issue in terms of improving compliance to these medications, which must be the single most important issue now, is to make sure that women actually do take their treatment for the prescribed length of time. I think we're in a different period now for actually understanding the results of clinical trials. Historically, overall survival and disease-free survival were accepted as simple endpoints, and when most patients actually died from their breast cancer, they were appropriate. We're now in a period in which most women will not die of their breast cancer. They'll live long enough to die of something else, and that using these endpoints, which includes deaths from causes unrelated to breast cancer, is quite inappropriate. And we really should separate the efficacy analysis, which to my mind is best estimated by looking at the time to distant recurrence as a good surrogate for deaths from breast cancer. We do really, I think, need to change our focus to really focus on efficacy endpoints that are related to breast cancer, not overall survival.